Hi, and welcome to another video from the CTAG Clinic. My name is Dr. Mike Lloyd and I'm the Clinic Director. In the video today, I'm going to be answering a question that subscribers have put to me because I asked them to do this. Now, the question is related to what it's like to not actually be dissociative, and this is something that quite a few of the patients in our therapy sessions do ask us from time to time, just to try and get a bit of a sense of what it is that they're either working towards or how different their internal experience might be to someone who doesn't have trauma, doesn't have any dissociation as part of their general makeup. And we get into these conversations, and it's quite interesting to use sort of my own experience as a sounding board, because obviously I'm the only one who really knows what it's like for me inside. So being able to try and describe that often helps patients really try and understand what the variation is and kind of what it means to be dissociative and what it means to not be dissociative. So I thought it would be interesting because quite a few people have asked this question through the comments. You know, exactly trying to work that out. What exactly is it to not have dissociation? What's the internal experience of this? This video is going to be a start of that. Now, I realized from the amount of questions that I'd received, and thank you so much to everybody that's put this, and sometimes it's people sort of describing their own experience and just looking for clarification. Sometimes it's an actual sort of direct question related to, say, the inner world of somebody like myself. Assuming, of course, that I'm fairly representative of people without mental health, without trauma, and without dissociation. You know, I can't really tell that, but I know I'm pretty similar to a lot of my friends because we do talk about this because they ask. So with so many questions and so many variables of this, I tried to narrow it down to a couple of things, but I thought it'd probably be easier to try and establish what the concepts of not being dissociative might be about. So rather than just give my experience to say, hey, here's what it's like to feel like me, I thought it would be useful to try and come up with some sort of theoretical foundation for this so that we can develop between us an understanding of what not being dissociative is like, and kind of also understand why dissociation has such an effect, and then why the internal experience of dissociation ends up like it does. Now, this is some theorizing, and obviously this is what I do within the clinical work, is we try and use established theories and see how they relate to dissociation, simply because there's just not enough stuff researched and written about this out there in the world as to try and really track down what is going on with dissociation. So I've thought of a couple of concepts that I wanted to go through in the video today, build on those things, and then use some part 2 and possibly a part 3 to load up some examples of what it's like sort of being non-dissociative to give a bit of a sense of these things. I hope that's an okay way of being able to deal with this question, because actually, when it comes down to it, it's a pretty massive concept. And the starting point is that dissociation is the lack of things that are usually connected to one another. So dissociation is like the lack of association. Now, association is something that somebody like me completely takes for granted. It isn't something that I actually think about. So I don't have to really put a lot of time and effort into thinking about the stuff that's going on around me because it's just there. Everything is associated. So in schema therapies, it's like we have all these core schemas for all these different things, and they kind of come together and work together and give us sense and give us a way of looking at the world. We have stereotypes for exactly the same sort of thing. They're kind of like time-saving internal devices that we can have in order to just be able to move around the world without having to stop and think about everything. Now, I know a lot of dissociative folks have to do that. Everything becomes a chore. It's a burden of responsibility to have to factor dissociation into almost everything that takes place. So going shopping, deciding what to eat, what time to go to bed, what to say to people, what not to say to people. There's so much time and effort put into this. For someone who is associative, like myself, really don't have to worry about that. Everything just sort of happens. And I'll try and describe why that is and why it's built on a foundation of development. And I'll use some of the theories of Piaget for this. Now, a lot of folks, you know, you can have debates about whether Piaget was right or wrong, or the developmental milestones and what times, whether he was right or wrong with those things. Personally, I really like Piaget's sense of understanding infant and child development, and I've used that a lot within my work over the years. So I really like the concepts of it, and I'm going to sort of build in one or two of those here. So to try and help you understand why association built into infant development is so important, and then when it breaks down, when that developmental milestone has not happened, and trauma, and usually as a result of traumatic type experiences, and dissociation kicks in, it really has a fundamental kind of breaking up of the developmental process. So two things I'm going to look at within this field to try and make sense of it. The first is social smiling and the second is object permanence. Now, social smiling is something that should have occurred within a general infant's development around about the age of sort of 2 to 3 months. And it's a process of engagement. So it's a way of the infant being able to make a connection to the outside world, to a caregiver, to somebody known, familiar and not scary. By smiling, it generates a smile in the adult smiles, the infant smiles, and a process of bonding and relation take place. So it's an associative process. The infant smiles to the world smiles back to the infant, and the infant knows that it can start having an impact on the world. So if it sees a caregiver coming towards it, and it looks at the caregiver and the infant smiles, it tends to generate a smile in the caregiver, and the infant then knows on a very precognitive level, remember this is 2 to 3 months of age, the infant has no conceptual understanding of the world, but it's developing an associative relationship with the caregiver. Now, that's normal development, so that's my development. So I smiled and my mum would have smiled back, or my dad would have smiled back, or my brother would have smiled back, and I learned the sense that I can have an effect and an impact on the world without really thinking about it. So it goes in as a core hardwired process. And now I'm over 50. I've had 50 years experience of knowing that I can impact the world, impact on people, and have a sense of a relationship and associative connection to all aspects of my world. Now, whether they're good or not is up for grabs, but I know that I have the ability to do that. Now, imagine in a traumatized and neglected or an abused infant, where there is maybe an angry parent or a dismissive parent or a neglectful parent, or a parent who's simply, because of maybe their own mental health issues or whatever's going on for them, is not attuned to that smiling. The infant smiled because that's the natural process. They do not get a smile in return, or they get ignored, or they get shouted at, or they see crying or distress or whatever it might be in the adult. And that process isn't then happening, because if the smile is not then returned, the infant might then learn that it can't impact, and it goes inside of itself. So at a very early stage, this is a key milestone. So infants that are raised in environments where there are not attuned or attentive caregivers really lack that ability of social smiling. And I think that that's a core process of association between people. So I know when I go out into the world, I am seen, I am noticed. If I do things, I can get a response from people. It gives me decisions, it gives me choices, it gives me problem solving abilities, and it's an innate sense. So when I traveled out to the States, I knew I could walk into any sort of particular room or building, and I could sit and I can converse with people, and I can have a good relationship being formed in the moment with complete strangers from a completely different country, because my innate sense of social smiling allows me the foundation for all of those skills later on in life. So this is essentially key. And of course, obviously with a lot of autistic children, they aren't doing that process. So autistic infants are not necessarily going to start smiling. The caregiver is not going to smile back to them because the infant's not smiling, and that can create a breakup between the bonding relationship. So from a really early age, if that's present or not present, can have a massive, massive difference on the development of that child, and then how that child learns to work and operate in the world. So we can see that this is a very, very key concept. It's a simple little thing, and can potentially have massive, massive consequences. And it's built in early to the infant's development, 2 to 3 months, because it's like it starts like this and it just grows out and out and out. And every bit of life relating to how we associate with people, how we form our relationships, you can see that the basis comes down to those tiny little moments early on in life. So me not being dissociative means that my social smiling skills means that I can walk into a room and I can smile at someone and I can expect to get a smile back. If I get a smile back from that person, I can start relating to them. If I don't get a smile back from that person, it tends to make me want to push away from them. So if I'm out on a walk and I walk past somebody and I nod and I smile and they smile in return, I think the world is kind. This is a good place to be. If I walk out and I smile at someone, they don't smile back at me, I then think, okay, that person isn't somebody that I really want to get to know. They're a little bit hostile, or they're doing their own thing. I don't really want to know. And I kind of put that person to one side. It doesn't come back to me though, because I know I smiled, and therefore I think I'm doing that relational aspect to the world. If someone doesn't smile in return, that tells me they're not the sort of person that I might want to know. So my relationships are then formed on the basis of who smiles back at me when I smile at them. So when I went to the States and I plunked myself down in a bar to watch a game and someone sat next to me and I turned around and I nodded and I smiled, and if they smiled back at me, we started a conversation, and a number of times I ended up talking for about an hour or 2 hours with a complete stranger, and we had a great laugh and we really enjoyed ourselves, and then we went our separate ways. But I had a wonderful experience of thinking that the world is a very kind and gentle place. I know it really isn't for a lot of people, but in my experience, that's how I can maneuver through the world. If I sit down and I don't smile at anybody, no one's going to connect to me, and I'm going to sit in an isolated little bubble in that bar on my own, eating my food, watching the TV, and I'm going to walk away from that feeling like nobody is interested in me, nobody cares. It's an isolated and unfriendly world. All comes down to that social smiling. So that's the point of the video today, is to give a sense of what it's like for me to be able to maneuver and associate my relationships, my people around the world, come from those concepts. I walk around, I look at what's going on, and I smile at people, and if depending on what I get in return, I can then determine the nature of what that relationship might be like. So when I'm on my own and I'm nowhere near anybody else, that innate sense of being able to walk out into the world and have access to it and have access to people and develop relationships is built in from the earliest age possible. And I use that in my world because I'm a very friendly person, and I go out and I can connect to people left, right, and center. So folks that have got really sort of traumatic upbringings, that have got a sort of abusive or neglectful upbringings, or who might have a sort of a deep level of autism where that connection just can't form, can see the world as being very hostile and very unfriendly because those connections are not being formed. And when the connections are not being formed, the outside world is not then relating in. Because if a person walks into the world and they've got a frown on their face and they look like they're not enjoying life and they're not happy, people tend to keep a distance. They stay away. If you walk through life and you've got a smile on your face, people tend to come close to you. Now again, because I'm not traumatized, that's not a threat to me. But for people who are threatened by people, if they walk out into the world and they smile, that's going to attract people to them, and that might be really dangerous and frightening for them. So they're not going to do it. So people are kept at a distance and the level of isolation can remain. So just on this first video, thinking about social smiling, how important that can be in just relating to the world, being present in the world, feeling comfortable and safe in the world, all comes back to these early concepts. And a lot of the patients I work with have got very, very dark and unpleasant childhoods where clearly that sort of stuff was not taking place at all, and you can see the impact on those people later in life. Now, it can be overturned, and there's a lot of things that can be done to try and improve on this, and that's really powerful. And a lot of kids, they may not have that, but it grows because they go into school and there's a lot of positive things. So there's a lot of ways in which this can be repaired. But if it doesn't get repaired and dissociation kicks in, the distance between the person and the outside world and the people in the outside the world tends to increase and increase and increase over time. So that's really the first start. And I can see just from talking about this, how detailed and how in-depth everything can become. So I'm going to do the next video on object permanence, and I'm going to do the same thing. I'll sort of describe what the general theory of that is, and then look to see how that affects on things like memory and a sense of being real in the world, which obviously affects a lot of folks with depersonalization and derealization issues, as much as the other sort of more complex forms such as OSDD and DID. So please leave sort of comments just on this. I'd be really interested to know if anyone actually just thinks this is helpful in any way whatsoever, just to get a sense of this. And I'll put the next video together looking at these other features, and maybe this will be a bit of those sort of an ongoing series, which is always quite fun for me to do, and I hope you appreciate and enjoy those as much as I do. So thanks ever so much to everyone for putting the questions down. This is the start, and we'll keep working on it. So please leave the comments, please do all the usual subscribing, liking, and all that kind of thing. And between now and the next video, as always, please do take great care.